Hello, this is Dr. Grande. Today's question is, what is Adlerian therapy? So Adlerian therapy is a therapeutic modality that was developed by Alfred Adler in the early 1900s, and it's been expanded on since then. It's a therapy that we see once in a while. I wouldn't consider it popular, but there are plenty of individuals out there who practice Adlerian therapy. It's a humanistic therapy and a positive therapy. So when you look at Adlerian therapy, there's this sense that there's a lot going on. It's a complex therapy. It has a lot of components that Adler borrowed from other therapies, as well as components that he created. It uses the context of the family and society, so it's contextual. So it doesn't look at the individual as being separate of these other systems. There is this idea in Adlerian therapy that individuals are striving to be successful. And as part of this, Adler has the inferiority complex and the superiority complex. So this probably came, in part at least, from Adler's own experiences when he was young. And he placed a great deal of emphasis on these. You can see these throughout the theory. He believed that inferiority could be turned around and used to be motivational to allow somebody to succeed, and that superiority was generally good but could be problematic if taken too far. One of the features we see with Adlerian therapy is the idea of birth order. He placed a good deal of emphasis on birth order. If somebody was born first or the middle child or born last, and how that would affect their personality. This birth order piece is tied to inferiority, superiority, as well as the context of family. Now it's worth mentioning with the birth order component of Adlerian therapy that the evidence doesn't support that Adler was correct about this. Birth order doesn't seem to have the impact on personality that he theorized. Now this doesn't invalidate the entire theory. This is just one component that the evidence hasn't supported. Adlerian therapy includes the value of childhood memories and experiences to inform counseling. It has a number of cognitive techniques and other interesting techniques. So a cognitive technique example would be the push button technique. There's also other techniques like paradoxical interventions and the acting as if technique. Adler actually had a number of techniques he identified in addition to those. He also was interested in personality theory and personality traits, and that was part of his theory. It tied in with the birth order. Adler has this concept of the style of life, which is formed from childhood experiences and the interaction with the family. And he also has the idea of social interest, which is somebody's innate desire to be cooperative and how they express cooperation. So a lot of times when we look at the goals of Adlerian therapy, style of life and social interests come up. Adlerian therapy is also considered an insight-based therapy. So one of the goals of this therapy is to develop insight and to create new insight. Other goals include challenging self-defeating behaviors, increasing social interest, so increasing efforts to cooperate with other people and family members. Developing problem-solving skills is a goal in Adlerian therapy, and creating an adaptive style of life. So using those childhood experiences, using the relationship with family members, and trying to adapt. This kind of ties in with striving to success as well, which, as I mentioned, is a key part of the theory. So what are some of the criticisms or limitations of Adlerian therapy? Well, there are actually several criticisms we see of Adlerian therapy. And what's interesting is sometimes I see the opposite criticism of this same theory. For example, I see the criticism that Adlerian therapy is too brief, but then I see other criticisms that it's too extended. I would have to say, in my opinion, that it's a fair criticism to say that Adlerian therapy is complex and extended, meaning for the therapy to work the way it was intended or the way that it should theoretically, it would take a long time. It's not really, in my opinion, a brief modality. Another popular criticism is that it works well with people that are insightful, intelligent, and highly verbal, but not with people that aren't. I think this criticism has some basis in reality. I think it's somewhat logical. But Adlerian therapy has so many different techniques, and the philosophy of it's fairly complex. I think it can work with a wide range of personalities and levels of intelligence and levels of insight and degrees that somebody is verbal. Another criticism is that the evidence supports Adlerian therapy, but there's really not enough research. I think this is fair. Overall, it's clear that this therapy is generally effective to treat mental health pathology, to treat mental health symptoms, but certainly more research is needed with Adlerian therapy. I think this is a criticism that could be applied to a number of mental health therapies. And the last criticism has to do with really what I talked about earlier, the complexity. There's this sense that Adlerian therapy is maybe overly complex and a bit fragmented. So what I mean by that is, if you look at all the different techniques we see in Adlerian therapy, like the cognitive techniques and the emphasis on personality traits, as well as dreams, interpreting dreams and transference, there seems like there's a lot going on. There's a lot of different pieces, but when you read Adler's writings on his theory, they don't really seem to come together as a comprehensive and cohesive modality. So there's a lot of moving parts, there's a lot to draw on that's very positive in Adlerian therapy, but it doesn't really all come together in a neat package. I think this is a criticism, again, that you could see with several modalities, but it stands out particularly so with Adlerian therapy. Similarly, I think we could say that Jungian therapy would have the same criticism. Jungian therapy is really complex and doesn't really seem to come together all the way. Now, at the same time, one of the things I like about Adlerian therapy is this complexity. I think Adlerian therapy as a standalone modality is generally effective and can be used, but also you can take elements of Adlerian therapy and integrate it in with other more modern theories. And I think this is often the way we see Adlerian therapy used. Adlerian therapy teaches us a lot about how theories were formed in the early days of psychotherapy. And it's really one of the first theories to put cognitive together with elements like transference and personality traits. And it also has some clever ideas like the inferiority and superiority complex. So Adlerian offers us a lot to work with. Is it an excellent theory? Well, probably not by today's standards, but it's certainly a great learning opportunity. And I think a lot of the components can come together and be very helpful. So overall, in my opinion, a good therapy, one that needs to be brought together a little bit more, but teaches us a lot about counseling. I hope you found this description of Adlerian therapy to be interesting. Thanks for watching.